Hey guys, what's up? So I just wanted to make a video, another electrolysis video, because I've been getting a lot of questions and I just wanted to answer some of those questions for you guys. Question number one is, why am I having electrolysis? Why am I getting this done? And that is because on June 13th, I am having phalloplasty surgery with Dr. Chen in San Francisco. Easy way to say it, I'm getting a penis. And they're using my arm as a skin graft. And yeah guys, you're looking at my future penis right now. Do I have to censor my arm? Just kidding. Anyways, I've also been getting more questions like, does it hurt? How often do you have to go? How many sessions per week do you have to go? How long before surgery do you have to start electrolysis? And why don't I get laser hair removal instead of electrolysis? So I sat down with my electrologist, and during a session I asked her some questions, and she is a lot more knowledgeable than I am, so she kind of goes into more detail of electrolysis versus laser and all that sorts of things like that. So that is what this video is going to be about. I'm about to show that clip, but I just want to show you the comparison of, this is my left arm that I've been having electrolysis on for my skin graft, and it's pretty much done. Mostly there's like a little bit of patch of hair that's left right here, but the rest is gonna just be maintained pretty much now for 3 months. And then here's my left arm. As you can see, it's, I don't know, it's a lot hairier on the left arm, I mean on the right arm than the left arm. I'm pretty naked over here. Also, no one has noticed that I have one hairless arm yet, so that's kind of cool. I've been kind of running through my head of what I would say to someone if they asked why one of my arms had no hair on it. Any suggestions for that, leave those in the comments below, because the only thing that I can think of is a comment that someone suggested before is that I'm preparing to get a tattoo, because I do have tattoos, so that's pretty believable. But I've never pre-prepared for a tattoo before. I don't know. Leave your suggestions down below. Here's the video. Enjoy, and thank you for watching. Do you want to briefly explain what you're doing when you insert the needle?
Well, we're inserting into the follicle the current, then we apply the current. This modality is known as the blend, so it's a manual modality, so I determine the timing and the intensity. So we apply the current, and then we test the hair. And when the hair releases, like that just did, we consider that follicle treated. And then we go ahead and give it a little after count with current, just to make sure we fill that follicle up with current. And with direct current, we're creating a chemical reaction where lye, sodium hydroxide, is produced. That's one side of the blend. The other side is alternating current, and that has a heating action. So between the two, this modality has been around since the 1940s. Between the two kinds of current, it's real effective. And usually I think all doctors want permanent hair removal. They don't want their patients to have any question as to whether, you're going to be able to clear an area. That's why most doctors, I think, if not all, order electrolysis instead of laser. Laser is okay. It's good in some respects because it's faster. And if, sometimes people want most of the hair gone, then laser is okay for body work. But for face work, it doesn't work very well at all. So electrolysis is pretty much the proven method for permanence.
What is the difference between laser hair removal and electrolysis?
Well, with laser hair removal, they're passing a very strong, bright light over the surface of your skin. And the theory with that is that the intensity, the current follows the hair shaft down to destroy the root with the laser's energy. But it has to be able to be absorbed by the hair and not the skin. So with electrolysis, we're inserting a sterile needle into the follicle, and we're applying electric current, alternating and direct current. With this modality, it's known as the blend. The reason that you hear that electrolysis is permanent and laser is not permanent hair removal is because sometimes the intensity of the laser isn't able to destroy the follicle like electrolysis is, because with electrolysis that current starts at the tip of the probe and we are in the follicle, so the follicle is destroyed. With electrolysis, it doesn't matter what color skin you have or what color hair you have. It's proven to be permanent hair removal. Laser cannot say permanent hair removal, they can say permanent hair reduction. They do have some results, sometimes good results, but sometimes not so good results. And with all the variables with skin and hair and depth of the hair, stage of the hair's growth, it's hard for laser to address all of the variables that there are with skin and hair. Electrolysis has been around since 1875, so the reason it's still around is because it is permanent hair removal.
What would you say the difference is in, as far as pain goes, with laser versus?
I've never had any laser. I've heard that laser is painful. Some of my clients that have had it say they would rather have electrolysis as far as the pain. And usually the laser physicians and the nurses that work in those, medical spas that do laser, it's pretty much automatic to put a numbing cream on before the procedure. Whereas with electrolysis, some people need numbing cream and some people don't. And every area is different. Some areas are more sensitive than others. But it's common to use numbing cream, but it's not everybody uses it with electrolysis.
Right. How many trans patients do you think you've worked on over the years?
I don't know, maybe about a dozen or 15. Overall, it's not the majority of my clientele. A lot of people, just are doing it for cosmetics reasons.
What do you have to say for electrologists that won't work on trans patients?
I think they should just get to know my trans clients. Are some of the best people I've ever met. They're so dedicated, and they know what it's like to have hard times. They're understanding people and wonderful people. I mean, it's up to the electrologist if they want to do, some areas some electrologists don't want to work on, and I guess I understand that, but to me it doesn't really matter where the hair is, it's still just hair to treat. It's not too painful, is it?
No.
It's pretty tolerable. The more you do it too, the more tolerance you build for it.
Yeah.
Sometimes the first time is kind of shocking, but gets easier.
It's my arm after electrolysis. It does hurt a little bit, and makes it look pretty horrible afterwards. Alright guys, that's it for this video. I hope this was helpful for you. I know it's more informational, so it's not the most exciting, but if you are looking into starting electrolysis, hopefully this gives you a little bit more information. I haven't found a whole lot about electrolysis on YouTube, so it just kind of gives you an idea of what to expect and how early to start, even though the doctors say you can start like 7 months before, or 7 to 6 months before. That was what I was told, but ideally you should start as soon as possible, like a year. So get on that if you haven't yet. Feel free to ask me more questions, leave them in the comments down below. Make sure to give this a thumbs up if you liked it, and yeah, peace out, and I'll see you next time.